The Ontario Health Coalition voicing concerns about the Ford government's health care bill that invests in private clinics.
The advocacy group says it will hold a 10:30 news conference this morning to speak out against Bill 60. They say they'll present evidence showing private clinics charge patients for medically necessary services, upsell patients, and make access to care contingent on paying extra fees. The province has said, though, that clinics must allow patients to use their OHIP card to pay for services and can't refuse service to someone because they refuse upgrades.
And speaking of that, a new study from the Angus Reid Institute finds Canadians are really divided over healthcare privatization. Last week, Bill 60 was tabled, expanding the role of private clinics.
CP24's Eden Debeba is live with the latest on this. And Eden, you were saying it's pretty much split down the middle here.
Exactly. Three ways, in fact. The first and the biggest cut of it, 39% of people saying that they're for public health care. They really don't want to see any kind of privatization in any form here in Ontario. On the other end of the spectrum, only 28% of people saying that they're for privatization, at least in some capacity. It might be not 100%, some sort of hybrid model. But at the end of the day, they feel that privatization does breed innovation. It's just the future evolution of Ontario healthcare. And of course, the last 33% are somewhere in between. They kind of see both sides, can see the pros and cons of each, but are still wary of full-on privatization. Now, the big reason, or potentially one of the biggest reasons for this divide, is because many people aren't agreeing on what privatization actually is. The model we're seeing here in Ontario with the province funding some of privatized health clinics, 55%, or rather 51% of people say that does count as privatization. Another 33% saying they don't feel that's the case. Everyone seems to be in agreement, or at least majority of people, 71%, saying that if there is any kind of money coming out of your pocket, that is privatization. So definitions seem to be here or there. Some other interesting key findings here, though. About 54% of Ontarians believe that provinces are intentionally ruining public health care in order to incentivize people to really open up to the idea of privatization. And according to this Angus Reid poll, that could be working. 28% is nothing to turn your nose up to. We're going to be speaking to a representative from the Angus Reid around 10 a.m. this morning to get a little more information on the data, what it really means for Ontarians. And of course, we're going to be following that announcement from the Premier and the Prime Minister later this afternoon.
Yeah, plenty of elements happening today. Eden Debeba teeing it up for us from Hospital Road this morning. Thank you, Eden.